Go.
We are here with Haley. Haley's agreed to allow us to do film her adjustment. She's how many months pregnant?
34 weeks.
34 weeks pregnant. Months. 34 weeks pregnant. So she originally came in with back pain, sciatica, neck pain, headaches. This is her second one. You just saw us adjust Matthew, her little one, and so she's got another one cooking. And so she's been coming in now for a couple months herself, and she's doing really well with care, right? Your back is better, sciatica is better, neck headaches. Sometimes she still gets some neck tension, which leads to some headache because of carrying Mr. Matthew and being pregnant at the same time.
A lot of extra weight.
So we're just gonna follow one of her office visits. We're gonna come and watch scope.
Sure.
Or something like that. So we scope because this thing helps find what we refer to as subluxation, stress in the spine. And we look for the needle, motion of the needle. It's got a little tension here.
You can take him out there also if you want to.
Okay. Yeah. Anything I need to know? Anything change? Anything different? Anything updated?
My neck has been pretty bad the past 2 days.
Okay.
That's the same thing.
Neck the last 2 days. Some people motion the sacroiliac joints where they put their hands here and they watch the person bring their knees out and together. I like feeling the sacroiliac joints for motion, for mobility. And so her right side's a little locked up here. Joint gets locked up, stuck, doesn't move properly. So we're going to try and release that right sacroiliac joint. Her L5 feels pretty good. Haley is a master bartender, and she is an amazing musician, a woman of many talents.
Thank you.
Although I've yet to hear you live. I have to come out and hear you live.
Valentine's Day is the next one.
Valentine's Day?
Yeah.
Oh, yeah?
Unless you have other plans, which would make sense. But
I don't know. Maybe we can make plans to come hear you sing.
Sounds like a plan.
She's got a little left C5, left atlas area. I'm feeling a C1 and I'm feeling a C5. I might go for a C5, that's what I'm feeling. And she's got a lot of tension in her traps. I don't know why.
me neither.
Okay. Sometimes we put someone that's pregnant on a knee chest table. Sometimes we put them here. It depends on stress on their belly and how they're feeling. So if you feel pressure too much here, you can move to this table. But you've been pretty good so far on this table. We'll crank this up to give it some room. And your face goes in the hole. So this is just a routine adjustment for her, a routine checkup, I should say, since she's been getting adjusted regularly for the last couple months. You okay? Everything all right?
Yeah.
Belly good?
Belly's great.
Back good? Face good? Chest good? Everything okay?
Yeah.
Good. Just want to make sure mommy's comfortable. I check knees. Feel glide for knees. Sometimes you do a leg check just to see if there's one leg shorter than the other and the right leg is a little bit shorter than the left. So we've got a right side joint that's locked up, so it could pull this leg up. Just feel the tension along the spine, lower back. She's got a little bit more right side, low back tension here, and then into here. Were those sneezes? Bless you.
You just needed a plastic tip. Did you need an extra plastic?
So So I'm going to adjust T5 first. Pregnant women tend to be a little easier to adjust. That already started popping under my hand, just setting down. But you're going to feel me lean and just push through, and that was definitely deeper. And I check the rotator cuff tendons. They can be tender on some people. I'll work these out. I'll get into them a little bit more. I'll do some trigger point in the area. I won't go through all that now, but. I'm going to turn mommy around. Turn over on your back, please.
It's just moving.
We still don't know what we're having.
No.
It's a girl.
I'm taking bets.
That's my guess.
Literally, I take the bet.
Hanging out over here. So now feel for trigger points. Sometimes there's trigger points in the abdominal area, and you just feel for them. Just to release some pressure off the belly, off the uterus. Right there. You feel that.
Oh, yeah.
I feel it. And I just hold that for a little bit. And if I'm mean, I could dig in a little bit, but I won't do that to you.
Thanks.
Sometimes a chiropractor gets, a little bit of, how do we say, fun and amusement by torturing other people, by digging into a trigger point sometimes. I like to see facial expressions and see, what kind of interesting sounds and facial expressions we can get out of people. Just kidding.
Thanks. Are you?
I have to say that on video. So.
Now, what does this regular adjustment do to help Haley through her labor and delivery down the road?
Well, women that get adjusted have been shown to have less pain, less discomfort, help them through their pregnancy, support their pregnancy. Some women have pain like sciatica, low back pain, neck pain, headaches. That's common. But some of the other things, it helps in aid in delivery. When a woman's pelvis is in better alignment, when her sacroiliac joints can expand, when her pelvis can expand, there's better chances of less complications during delivery, easier delivery. So we find that women have less complications, they deliver faster, they deliver better, and not only that, just the health benefits. We talk about the stress on the nervous system controlling and coordinating everything. So you want to make sure that during a pregnancy, during growth and development, that her nervous system's functioning well for growth and development of baby, and baby gets what they need. And then during pregnancy, that she goes through the labor properly without real minimal complications or problems. So there's a lot of health benefits to getting adjusted in general, but especially during pregnancy. And I feel that dissipate under my hand, so it's not as prominent. If I dig harder, you could feel it, but but it's better. It's not as...
Feels better.
Yeah.
It'll also help her recovery time be faster too after delivery, correct?
Sure. Yeah, I mean, anytime you're in better alignment, you heal faster, you heal better, you recover faster, you function better, you feel better. If I repeated myself during all those, I may have. And I'll check knees on this side. So belly doesn't get in the way.
It hasn't been so much in the way this time. That's good.
check feet. Feet are important. One, she's on them all day or a lot of the day. Both for work and moving around and carrying Matthew and carrying the one in her belly. So I want to make sure her feet and knees are in good shape. Feet are the foundation for everything above. So you have issues with the feet in general. Like she has a little bit of tension in her navicular here.
Yeah, I've been letting Matthew rub my ankle every night.
We adjusted our cuboid. I'll get up to her knee. And you feel a separation in the knee. She might have felt that in the hip too a little bit. But her inner knees are a little locked up, so I'm going to release her knee. Don't worry, I won't pull you off the table, just down the table.
You pulled me back the other
Grab
way.
my wrist.
Here, Mama. Here, Mama.
What's up there, Mr. Man?
Here, Mama. Mama.
Who's crawling? Who's crawling? With a smile on his face. Grab my wrist. Just stretch Haley out. I just noticed you have guitars on your shirt.
Yeah.
Appropriate for the guitar player.
It makes my belly look smaller.
Hey.
We're gonna go to this table.
Wait a minute, Mama.
You're laying on your side facing me, shoulder here, head there. You're fine.
There's Mama. There's Mama. All straightened out.
So if your belly is away, you might feel some pressure. Just let me know if you have any discomfort. And adjust this right sacroiliac joint. That moved a lot.
Yes, it did.
Let's go to that table. Chair.
That was awesome. I'm sorry. Here.
So feeling for that sacroiliac joint, it's now moving. Her T5 moving better. And adjust some shoulders too because she's constantly holding Matthew. Want to bring her shoulders back. So we'll stretch her out a little bit. Check elbows. Haley's got some cool artwork on her. You don't see it all right now, but she's got some cool artwork on her.
It's covered up.
It's covered up.
It's stretched out right now.
Now you lean back in your chair. In the chair.
My chair. We
Your
heard
chair.
that.
It's your chair.
You
That's
take
it.
whatever when she leaves. That released a lot of pressure in your neck already.
Mhm.
Sometimes when you adjust the lower back and mid back, you feel a lot less tension in the neck because all the musculature all compensates. But I was feeling a lot of left upper neck and a C5. I'm feeling a little bit, so we'll do a little C5 on Haley. Haley's known to kick and scream and buck and really like fly out of the chair, so I want to secure it. No, I'm just kidding. I want to secure her in the chair.
I mean, you see my son do it, right?
Try to bring your left ear to your left shoulder. I'm just going to feel you push that one. Good job, Haley. Good job, Haley.
Good job, Dr. Dave.
It's teamwork. All right. So that is Haley's routine checkup here at Chiropractic. Right sacroiliac joint T5, left C5, and then did some extremity work. But waiting for this little one to grow, pop out, and we're excited to see what it is.
It's a girl.
I'm betting a girl. That's how I'm betting.
Okay.
All right. Any final words for people?
I suggest doing it. I definitely do. It helps tremendously.
There you go.
Say bye-bye, Matthew.
Bye-bye. Say bye-bye.